So she did get a degree in broadcasting journalism, got an internship at KITV, and worked in general assignment repairs. So it definitely seems like you've been in the know for quite some time. And after 8 years, she moved to the position she's at now as Public Information Officer for the Honolulu Emergency Services Department, which consists of the Medical Services and Ocean Safety divisions. It's definitely been a challenging and rewarding career. Every day she gets to wake up and work for two groups of heroes. I would assume that her professional heroes and probably her family heroes. So with a warm introduction, and I did get the chance to meet with Shayne. Do want to say thank you for joining us, and please tell us a little bit about what you do, your department, and anything that how we can help you.
Yeah, I will. And logistics wise, is this okay? Because I just tried to turn the camera. We good?
Yes, that's great.
Okay, awesome. Okay, thank you everyone. And yes, I first want to start off with saying thank you to all of you. You in, I believe, April or May, purchased lunches that went to our paramedics and EMTs in Waikiki, Wailupe, Hawaii Kai, and even we made some to Waimanalo. And it was very, very much appreciated during this long marathon of a pandemic. So thank you for having me. So yes, I was asked to come on, and I really wanted to just give you some background on, especially on emergency medical services, because EMS is just that group of people that people know are there, people don't want to ever see, understandably, and but people don't really understand how it all works. So emergency medical services is with Ocean Safety, our lifeguards in one department called Honolulu Emergency Services Department. And you have your police department, your fire department, and Honolulu ESD. So in our department, you got your paramedics, EMTs, ambulances, you got your ocean safety, you got your lifeguards at all the beaches. And today I'll focus more on the EMS side. So for EMS, we have 21 ambulances. So if you think of it in correlation to fire stations, we have 21 stations. So if you live in Waimanalo, you have one. If you live in Kailua, you have one. Now we have more than 21 neighborhoods or communities. So we have to kind of spread them out to be strategic. So say Mililani, you know, big community, but Mililani does not have its own ambulance. So the closest ambulance to Mililani would be Waipio. So when you call 911, the calls are coming in constantly. We average about 250 to 300 calls. And this is pre-pandemic, when the first lockdown went into place. Those numbers dropped significantly because people were staying at home. So your preventable emergencies were not happening. You're falling off of your bike, you're falling off of a mountain, you know, all those injuries we weren't responding to. We were still responding to the medical calls, and we were responding to a lot of people that had fevers because they were anxious, they were worried. So I'll come back to that. So the 21 units for nearly 1 million people. So when those calls come in, it's up to the dispatchers to basically rank those calls. What call sounds the most important? So that's why I will let you, and please let your family and friends know, whenever you need to call for EMS, when you call 911 and you ask for the ambulance, you need to try to do your best to give the most accurate information in a calm manner. Trust me, I've been there. It's very difficult to do, but that information will help the dispatchers get the closest ambulance to you, because we only have 21 ambulances. Sometimes we have 25 calls going on. So the lower ranking calls, those calls that might not need emergency services right away, or at all, I should say, those calls are lower in the queue. So you're gonna go through these screening questions, and first thing people think is, why are you not sending the ambulance? Why are you asking so many questions? As soon as we get your location, which is the first question you're going to be asked, where is your emergency? As soon as we get that, it comes up on a map, and the closest available EMS crew and ambulance is notified. They're notified that they have a call at so-and-so address for the basics that we have. Then what happens is, as they're en route, the updating occurs automatically into their ambulance. They have a computer. So they'll be told, okay, this is a female, 67 years old. She's experiencing chills. And then, you know, if something unfortunate happens, like she stops breathing, that's gonna update it. So the paramedics know what they're arriving to, so they can mentally prepare and also get medicines ready. Start doing the calculations for those medicines that they're gonna have to give, because a baby is going to get much less medicine than a man weighing 300 pounds. All right, yes, exactly. Much less medicine than a man weighing much more. So all of that, they're kind of preparing. And of course, it always feels so much longer when you're waiting for help to arrive than actually it is taking. We completely understand that. It's not an easy time. So then what happens is they'll arrive on scene, and police and fire will come to, depending on the type of call. Usually cardiac arrest, the fire department will come. There's more than twice as many fire stations. So, and firefighters are trained in what's called basic life support. So they can do CPR, they can do bandaging, and they can assist EMS. So when EMS arrives, now I'm gonna talk pandemic time. They're gonna be in full PPE. So they're gonna have goggles, eye protection, mask, gloves. And that's for minimum call. That's if you call for a stub toe. And if you're all still with me, people call for stub toes. So we're there, we're with our PPEs. If there's any sort of symptoms, so if you called and you said your family member has fever, has loss of smell, was possibly exposed, or is actually positive COVID-19, we're gonna respond, and we're gonna respond in a Tyvek suit. So you gotta now, you know, put in there that all of this equipment takes extra time to put on. So add that to the response of coming to you and your loved one. It's a lot to take in, I know. But so then we get there, and then, you know, depending on the call, we're gonna ask you questions. So sometimes people get frustrated because they're like, let's just go to the emergency room. Let's just get there. Why are you not leaving is a common question. Why are you not going? Because if you're able to ask us those questions, you're okay. We need to find out what's wrong with you. Paramedics are educated, they're trained to a very high level. They can provide more than 50 different medications. They can, we don't diagnose, but we can, the right word is diagnose, because we look at you and we can tell if you're having a stroke. We deliver babies in the back of ambulances. So we need to gather as much information from you as possible, just in case you do go into cardiac arrest. You know, maybe you could tell us, you know, I haven't been feeling well for X amount of days, and I may have eaten something weird, and then, you know, all of a sudden you become unstable. Now that information we use it to treat you. We do take you to the emergency room, and en route to an emergency room, we call the physician, we call the ER doc, and we tell them we're coming in with a really bad car accident, female is altered. And so they know to get the CAT scan ready. They're gonna know that, okay, I'm coming in with a child, cardiac arrest. We're gonna go to Kapiolani, and that team at Kapiolani is gonna be ready to go. They need to call in all those doctors, right? You see on the television show, the alarms go off and everyone comes in. Well, some of that is real. So they'll all come in, and so that's en route. Now, when we get you to the emergency room, it's kind of like a transfer of care. You're no longer an EMS patient. You're now that particular hospital. Now, everyone's like, well, how do you choose which hospital you go to? Well, by law and by our policy, it's the closest hospital due to, remember, only 21 ambulances. So Kailua can't be traveling to Queens every day or all day, or right now even at all, because of the time it takes them to come back over the mountain, or even the time it takes them to go there. So they'll take you to Castle Castle is a great emergency room. Now, if it's a child and it warrants it, meaning the child is very ill or has special needs, we'll take you to Kapiolani. Everyone asks, to go to Kaiser if they're Kaiser patients. Our town crews do their best, but if you're a Kaiser patient and you live on the windward side or the west side, it's just not feasible because you're going to be taking out that ambulance from their area that they are dedicated to for too long. Queens is our #1 trauma system. So anything major, traumatic, bleeding, you'll go to Queens. And let's see. So then you're at the emergency room. We transfer you over. Then the next big question is expect a bill. So that is such a difficult one to answer because the city and EMS is not in charge of billing. We don't see a penny. We're trying to change that, but we don't see a penny of the billing. Your insurance handles your bill. They'll decide whether or not you needed to call an ambulance. And it can go either way. Sometimes people get a $1,300 bill, and that's the cost of taking an ambulance when it wasn't deemed an emergency. Deemed an emergency, it all depends on what your insurance is like and how much your copay will be. With that being said, another interesting aspect to emergency medical services, we're a city entity, but we're funded through the state legislature. It's a statewide system. So they fund every county, they take care of the money, they decide if you get a new ambulance. So the mayor of the city and county of Honolulu really doesn't have much to do with, is EMS gonna get more resources? So you can always go back, you can go to your area, you can check where your ambulance is located. And if you don't have one in your particular neighborhood, community, you might wanna go address it with your area representative. But that's kind of the background. Any questions?
Not really questions, but I have a comment. I broke my arm. I went to Queens, and yeah, it's not very. If you break your arm, don't go to Queens. Let me tell you that.
Oh yeah,
On the
yeah.
bottom, important factors.
Yeah. Did you go in the ambulance or you took yourself?
I took the person that kind of broke my arm. She took me. She was kind enough to take me. We did arm wrestling, so don't do arm wrestling. Yeah. I know you're seeing it all on TV right now, how busy the hospitals are. That's a very much a concern right now. Queens is the busiest hospital on the island. So if you can avoid going to Queens, I would, unless you really need surgery or immediate care for trauma. But other than that, all the other hospitals are good for broken arms. Any other questions about how emergency medical services work, about the pandemic and how it impacts EMS?
I have a question. Oh. Okay.
Go ahead.
Do you use the Smart 911 where if a person calls you on their cell phone, then you automatically know where they are, because I can program it so that you have all my medical information ahead of time?
We do. Have you signed up for that?
No, well, Major Nakata came and spoke from the police department particularly with people with disabilities, to pre-program that. So I've been encouraging that for a lot of people. But I just wondered, because you said that once you get the call, you ask questions and you have to kind of get things ready, but an individual can go in and say, I'm diabetic, I have hypertension, and put in everything in their profile, so that if I call, then, obviously you have to call from your cell phone, but then you know exactly where I am.
No, and you're absolutely correct. Yes, we do. We haven't had much, made much leeway with that due to people are just kind of concerned about putting that information out there. But I do for you know, our older population and those living alone, especially, I highly, highly recommend doing that system. It's only going to help you. And to be honest, you know, that's only, I mean, that's the only reason we're getting that information, you know, is to help you.
Okay, thanks.
Yes, definitely.
I just read in media that there was a period of time recently that diversion was occurring. Diversion, you know, the nearest hospital was not available. And so some of the hospitals were emergency rooms available were like at Waianae Comp.
Yes.
Could be over at, you know, more the rural areas. Was that accurate? What the media reported? Were people from, say, city transported to Waianae? Did that happen?
Yeah, just a little bit, but yes, I saw that. No, that didn't happen, but I did see that story as well last night on Hawaii News Now. And reroute happens every day. Certain hospitals will just fill up for whatever reason. It's going to happen more and more. You're not going to be in town and go to Waianae, again, because our resources can't sustain that, and Waianae is not built to handle most emergencies. You only go there really to be stabilized. So as far as reroute goes, if you're in town and Queens, Straub, Huakini, even Kaiser are all on reroute, it will go into what's called a round robin, and Queens will just have to take the next call, the next patient that's coming in. They won't, there's no choice. We don't show up. We never get there and they turn you around. It's all happening simultaneously. So throughout the day, the dispatchers are saying, just a notice of an update, Queens, Castle, and Huakini are all on reroute. So if I'm coming to you and you're living in town, I already know, I can tell you, you're not going to be able to go to Queens. You're not going to be able to go to Huakini. You know, your best option right now is Straub. And if you're having an emergency, which is how the system's supposed to work, you're really not going to care. You're going to be like, okay, at this point, no, my loved one really needs emergency care. Let's go to Straub. What happens is some people call and not necessarily need the ambulance. They think that the ambulance is going to get them ahead of the line at the ER. It's going to just get them there faster, so they'll get more care quicker. It's not always the case. And that brings up another point. If you're not having a medical emergency, the paramedics and the EMTs are not going to turn on the lights and sirens going to the hospital. We've all been there when an emergency vehicle pulls up behind you and they got their lights and sirens blaring and it sounds really loud and you're not sure what to do, which way to go, left, right, straight. Do I go through the red light? That creates more chaos and can lead to accidents where you could have potentially worse injuries than what you're currently dealing with. So we have to rank those calls by priority. Most calls go with lights and sirens, but there's a majority that we won't turn them on for safety reasons. Trying to think. Do you folks mostly live in town?
I live in Hawaii Kai. I know we have an ambulance in Hawaii Kai.
Yeah, you have an ambulance at the Hawaii Kai fire station. Yeah, and then the next one would be Wailupe. Yeah. And then the next one is in Waikiki. So they cover a lot of ground. They work 12-hour shifts, so from noon to midnight, and then midnight to noon. And in that shift, they can take anywhere from 12 to 15 calls. Now, what's happening now with the pandemic is everyone's gone back, you know, well, until tomorrow, but everyone kind of went back to their day-to-day routine. And so those call volume went back up, but you still have on top of that all the precautionary measures with the PPEs. So it's just mounting, I don't want to say the work, but the amount of time to get each call done from start to finish. So what we're really trying to push and educate is to first, of course, try to take care of yourself, you know, take your medications, call your doctor early if you're feeling sick, and to not wait to have to utilize EMS. We want to be there for those who are really having the emergencies. And people ask, what are emergencies? You know, everyone's determination of emergency is different, and that's okay. That's always going to be like that. But trouble breathing, you know, anything with breathing is always, you should call 911 right away. Bleeding, if you're bleeding profusely and you can't stop the bleeding, you should call 911. Anytime you're altered, you don't know where you are, you don't know your name, you can't answer questions, any sort of head injury, you should call 911. You know, people question calling for a broken bone. Okay, the thing is there's a lot of injuries that will be painful, but you're not gonna die if you don't go immediately or in an ambulance. So it's not just about getting you to the hospital, right, as quickly as possible. It's getting you that treatment at your house. You know, you're getting these medical professionals coming into your home to start that treatment, and then get you to a facility that can help you even further. So those are the people, the strokes, the heart attack, the ocean accidents, the long falls, the traumatic injuries. Those are all the reasons that EMS is out there.
You have a little, I guess, sheet or kind of a this is emergency versus this isn't like super important. Do you have a little thing that you could email me, and maybe we can send it out with the recap of our meeting today?
You know, I can. It's I always get a little weary because people might not call. So at the end of the day, I just tell people, you know, if you have somebody that is calm enough and is capable of taking you to the emergency room, then have him or her take you. I understand elderly couples where you're both old and, you know, you might not be moving as quickly, then call 911. We want to be there to take care of you. I'm talking about people my age, very capable of taking themselves or their friends or family, taking them. We show up, there's 6 vehicles in their driveway, and they just, you know, don't want to take the person. Those are the people that we're trying to get to understand. There is only there's only 21 ambulances, and we don't even have all of our visitors here, which usually take up a lot of our town units throughout the day. So those are the type of people we'll educate. And what I'll do is I'll write something up on how the process works, and examples of emergencies. I'll do that.
Definitely appreciate it. And I probably should have asked you explicitly, but is it okay if we share, you know, your the conversation and you coming on and giving a little speech about the department?
Yeah, sure, no problem.
Okay. Any other questions that people have? I have like one final question if anyone doesn't.
I was going to ask one small thing, Evan. Shayne, have you been noticing a more uptick in people signing up for EMT training, or however they start to become somebody that works in your department?
That's a great question. Yes, if you have children, we have out of nowhere. Well, not out of nowhere, but we would think because people seeing the pandemic and it's an essential job that you're not going to lose. We had a huge turnout to Kahala Community College. That's the only place in the state that offers EMT training. So you start at EMT level, and then you become a paramedic a couple years later, again back at Kahala college. So we have now it's just a full circle, because you have to have positions available though to hire those EMTs. And with every budget being looked at, vacancies are going to be the first to go, and new positions are unfortunately going to be unheard of for the next couple of years. So it's almost like it's a joke, because you have all these people now finally interested in a career that's very, very difficult to get people interested in because of how difficult it is, especially emotionally, mentally and emotionally, that now those people likely won't even get a chance, at least in the next few months to even middle of next year. Maybe after that, we hope people are still interested. The process at Kapiolani is 6 months. You know, an EMT program is short. The thing about EMS, it's not necessarily the classroom work. It's the experience. Can you take those difficult calls and show up to work the next day? After a couple of years of working under the paramedic, every ambulance here runs with at least one paramedic. After a couple of years, you go back, and to become a paramedic, it's about a year. And again, with becoming a paramedic, you're now in charge. You're responsible for that patient. Anything goes wrong, that's on you prior to going to the emergency room. So that's a great question. You know, I think once everything settles, we're going to take a really good look at where we can recruit, because we definitely could use people. Thank you. That's a good question. I should have brought that up.
It's all good. All right, one last question.
I have a comment. I work at a senior living community, and I just wanted to say thank you to the entire department, because we're one of those frequent callers, and the response has always been great. We really appreciate it. So thank you very much.
I'll pass that along. Thank you.
Okay, any last questions before we wrap up the meeting today? Okay, want to say, Shayne, thank you so much for joining us. It's nice to see you back in, work ready attire. It's kind of the same thing as me. I've only honestly been in like my full on long sleeve shirt with shorts and everything like 3 times in the past couple months. Otherwise, it's almost just, you might dress up on the top and wear slippers on the bottom, and it seems to be that's okay. Anka, any feedback that you have, any questions, concerns, any thoughts that you had from joining us today?
No, you're one of the first groups like yours to ask me to come on, and I hope I shared some information that you can pass on to your family and friends. And other than that, I just want to thank you again for your genuinely, your gesture earlier this year. It really, really meant a lot. Thank you.